right, we'll go ahead and get started today, if you guys are ready. So just a short introduction again for any of you who might be watching this that haven't seen me before. My name's Christina. I'm one of the therapists here at M3, and this is Brett. He's my tech who'll be helping me out today. So if you haven't seen the first two videos or gotten the exercise sheets, go ahead and look at those for the last 2 weeks. We're building off of those exercises today, and we're going to take it a little bit slower today. We're going to work a little bit more on some breathing mechanics to help us get our core really activated nice and tight. I've gotten some feedback that some people are having a hard time contracting their deep abdominals with the exercises that we're doing. And sometimes that's because we progress them too fast. When we do a class like this, I can't tell for each person if you're able to get that contraction before we move on to the next exercise. So I wanted to slow it down just a little bit today and focus more on breathing mechanics and how to really feel and make sure that you're getting that contraction of your abdominals before we move to more advanced exercises. Like last week, we did some more advanced exercises. So we're going to start today actually on our hands and knees. So if you have a yoga mat or something soft, carpeted, you can start there today. If you have knee problems, a pillow underneath your knees or something that's a little bit more cushioned will probably be better for you. Okay, so Brett's going to start here with his back nice and flat. His knees are directly under his hips. So I'll give you guys a minute to get into position here, just like Brett is. Okay, so starting here, just like this, we're gonna incorporate some breathing. So Brett's going to take a deep breath in, and as he exhales, he's going to pull his belly button up towards his spine and contract his deep abdominals, just like we've been talking about. Hold that for 3 seconds while you're breathing normally, and then relax. So go ahead and relax your abdominals. Let's try that again. So take a deep breath in. As you breathe out, I want you to pull your belly button up and in towards your spine. Hold it. Breathe normally as you hold that contraction. And relax. This is the easiest position to really feel your belly button lifting up towards your spine. That's how you know you're getting that contraction without any spine movement. Okay, so let's do this a few more times. Take a deep breath in. As you breathe out, bring that belly button up and in and contract your deep abdominals. Hold it and relax. Good. And again, take a deep breath in. Exhale and contract your abdominals. Hold it, breathe normally, and relax. We're going to keep going a few more times. I really want you to get the feel for that lifting of the abdominals up towards the spine. Breathe in and out. Contract your abdominals. Hold it tight and relax. Good, and again, take a deep breath in. Breathe out, contract the abdominals, hold it, and relax. One more time, take a deep breath in, breathe out, contract those abdominals, lift the belly button up towards the spine, hold it, and relax. Very good. So we're going to challenge this a little bit. I want you to have that same contraction that you just had with the breathing, but we're going to add in some arm movements here. So what Brett is going to do, he's going to inhale just like before. As he exhales, he's going to lift one arm up towards his head and bring it back down and inhale. Good. And then exhale, lift the arm, abs are tight, back down, inhale. And keep going. Exhale, abs are tight. Inhale, exhale, good. Keep going. So you should be feeling that belly button lifted up towards the spine. Back is not moving at all. And make sure your head's not hanging down towards the floor. You want a little bit of a chin tuck, keeping the head up so it's in line with the spine. Gonna keep going with this one. So inhale, exhale as you lift the arm, and inhale. Exhale, abs are tight, and inhale a few more. Exhale, inhale, last one. Exhale, inhale. Good, take a little break if you need one. Brett's gonna move now to an exercise we call bird dog, which the name doesn't matter, it's kind of a funny name. But he's going to do the same thing, but this time adding in the legs as another component here. So when one arm goes out straight, his opposite leg will come back extended, just like that. So it's really important to keep the abs tight the whole time and to not let the spine move. So it'll be really tempting to get a big arch in the back and to get more hip extension. A lot of people want to really kick that leg up towards the ceiling, but I don't want that. So only move the leg out as far as you can without extending at the spine. Sometimes putting like a book or a couch pillow or something on the back helps you know too if you're extending the spine or if you're rotating your pelvis side to side. Everything should be really flat and stable here, and the abs are tight. So talking about the breathing again, you're going to exhale as the arms and legs go out. Inhale as they come in together. Exhale, abs are tight. Inhale. Good. Exhale, pull that belly button in, and inhale. Very good. You're going to do a few more repetitions. Couple more on each side. Good. One more on each side. Last one. Very good. And take a break. So that's the best position to really feel like your abdominals are working hard because you feel that lift of the belly button into the spine. When you're on your back, like we do a lot of the exercises and we'll continue on your back today, it's a little harder to feel that contraction. So sometimes I have people just put their hand right on the side of their abdominals, right here, so right above the pelvic bone. If you place your hands there while you contract the abdominals, you should feel it tighten. And then as you relax, you should feel that it's squishy, okay? But when you contract, it hardens, those muscles get tight, and that's how you know that it's really strong. So go ahead on your back, Brett. Sorry, I took your pillow. Okay, so on your back here, I'll give you all a minute to get into position. So we're gonna do the same breathing exercise with the abdominal contraction on your back here. So just really basic to get our abdominals warmed up in this position. What I want you to do is take a deep breath in. As you breathe out, you're going to contract your abdominals, pull that belly button down into the spine and hold it. And relax. So we'll hold those about 5 seconds each. So take a deep breath in, breathe out, hold that contraction tight, breathe normally while you're holding that contraction, so don't hold your breath, and relax. Good, take a deep breath in, breathe out, contract the abdominals, hold it, and relax. So Brett has one hand on his stomach, and we talked about this the first week, I believe. When you inhale, your stomach kind of expands, and as you exhale, it depresses. So sometimes the hand on the stomach can help with that. If you need a review, I would encourage you to go back to the recording from the first week. We talked more about that. Let's do a few more of these. So take a deep breath in, breathe out, contract the abdominals, belly button comes in, and fold. And relax. Good, one more. Deep breath in, breathe out, contract, hold it, and relax. Very good. So that was just to get them warmed up. In this same position, I want you to get that abdominal contraction again. So pull your belly button down and in, feel your abs tighten, And then I want you to march with the legs, one and then the other. We're gonna do low marches, so just a few inches off the table, so not quite that high. There you go. And then you'll alternate sides while keeping your abdominals nice and tight. So you shouldn't feel your hips rocking side to side. They should be stable on the floor or the mat. To incorporate breathing for this one, Brett's already doing it here. When you breathe out, the leg's coming up. When you inhale, the leg is coming down towards the mat. So that exhale just helps you get all of the air out of your lungs and get the deep abdominals activated a little further. It just helps kind of get that contraction, which is why we're doing it today. A little more reinforcement for the abdominals. Because it's really hard to progress these exercises if you don't have a strong contraction. And there are times even where you may be in more pain because, say, you walked a lot last weekend or you did yard work or some sort of activity that made your back a little more irritated, then you might have to go down toward these basic exercises to get your abdominals working again in a way that's not painful before you can progress to more advanced exercises. So there will probably be times where you'll have to backtrack a little bit and just take care of yourself and monitor your symptoms before you can progress back to where you were before. All right, go ahead and take a break. So we're gonna move into a dead bug now. So opposite arm and leg. When one leg comes up, one arm goes back towards the head. So Brett will show you here, just like that. And then you'll come back to center and switch. So your abs should be tight the whole time. When the arm and leg go out, you should exhale. As they come in, you should inhale. So exhale, inhale, exhale, inhale. Good. Exhale, inhale, exhale, inhale. Good. Keep going. You should really feel your back flat on the table, like your belly button is being scooped down and in towards your spine. If you're doing these right, you should feel your abdominals contracting. Over time, it takes a lot to fatigue these muscles. They're more postural and endurance muscles. And so you may have to do 2 to 3 minutes of this exercise to really feel like you get a good workout. But after that, you should feel like your spine is nice and supported versus before exercise, you may be having a little more pain in the low back, your posture may be poor. But as you work on these abdominal muscles, it increases your posture and stabilizes the spine. It should make you feel a lot better. One more. Very good. All right, go ahead and take a break. So our abdominals are nice and warmed up now. Hopefully you're able to feel that contraction nice and strong. So we're gonna progress to some more advanced exercises like we did last week, but really focusing on getting that core really tight and strong through each exercise. Okay, so let's start with some clams on your side. We did these last week. I think we did them last week. Yeah, with a band. So I'm going easy on Brett today. He doesn't have a band. But if you have a TheraBand at home, this is the time when you would put it above the knee. Okay, so ankles are together. Brett's gonna put his hands here. And what I want you to do is push down a little bit into the floor. And as you push down, I want you to feel that belly button come in towards the spine and contract your abdominals. So hold those abdominals nice and tight as you clam. Okay, so one knee comes up and back down. Good, so we're gonna do 12 of these. 30. Notice how Brett's back is stable. His hips aren't rotating towards the wall. You may not be able to go as high with the knee because your back is rotating, and that's okay. Some people with less hip mobility can't get as high with the knee. That's perfectly fine. Just go as high as you can without rotating at the spine of the hip. Good. Keep your abdominals nice and tight. Good, so Brett's incorporating some breathing here naturally as well. So when you clam up with the knee, you'll exhale, you breathe out. As the knee comes down, you breathe in. Good. Good. So you'll breathe in and exhale. Breathe in and exhale. You should really feel those abdominals tighten as you exhale. How many is that? We've done too many. Okay, take a break there. Let's go ahead and switch to the other side. So for those, if you don't have a band, probably 3 sets of 12 is appropriate for those. If you do have a band, then you probably would do more like 3 sets of 10 or 2 sets of 10, depending on how tight your band is. Okay, let's go ahead and do the same thing from this side. So you still want your hand on the mat, contracting your abdominals, exhaling as the knee comes up, and inhaling as the knee comes down. Very good. So the tighter your core is, the less likely your back and hips are to be moving. How many is that, Brett? That's 10. 2 more, and then we'll flip sides again. Okay, so after about 12, let's go ahead and flip to the other side, and we'll repeat that again. So you should be feeling your core at this point and also your hip muscles. All right. Same thing on this side.
Christina, can you take a look and see if I'm doing it correctly?
Sure. I think it will bring it up for everyone. That looks good to me, Allison. It doesn't look like you're rotating at all. Yeah, that looks good. So if this is too easy, but you don't have access to a band, then one thing you can do, that's true, I didn't think about that. I was thinking about something else. We'll get there. So one thing you can do is when you lift the knee up, you can hold it for a few seconds before you lower it back down. That isometric, we call it, contraction at the top of the range of the hip will help activate those muscles a little bit more. So the slower you go, the more you hold it at the top, the more you'll feel those hip muscles. All right, let's go ahead and alternate to the other side. So Brett was about to show you an advanced version of this exercise, so I'm gonna have him do it on this side. So same thing, but you're just gonna elevate the ankles above the mat and clam from this position. Same abdominal contraction, hips and back aren't moving. And the other thing is, if you're not feeling like your hip muscles are kicking in, our body is really good at compensating when we're weak. So what you can do is use a little brain power and tell your brain to squeeze those hip muscles, squeeze your glutes before you lift the knee up. Sometimes that helps to get a little bit more activation of those muscles. How many is this, Brett? 13. Okay, let's go ahead and take a break there. All right, so I'll have you roll onto your back. All right. Okay, so we're gonna do some bridges here, which most of you have probably done before. We're gonna do some bridges with marching. So what I'm gonna have Brett do is keep his abdominals nice and tight as he bridges. That's gonna help his low back stay really stable in the air. So I'm gonna have him hold this bridge, and he's gonna march, bringing one knee up and down, the other knee up and down, and then he'll bridge down. If this is easy for you, you can hold the hips up. You don't have to keep bridging down towards the mat, but I'll have Brett keep bridging back down. Okay, so go ahead and come up. Abs are tight. One hip comes towards you and down, and then you'll alternate. And then hips come down. Good. So let's incorporate some breathing into this as well today. So go ahead and lift up. As you bring one knee towards you, you'll exhale. Foot comes down, inhale. Knee comes up, exhale. Foot goes down, inhale. Good. And again. So you'll exhale as the knee comes up. Inhale when the foot goes down towards the mat.
Do you want me to keep bridging or?
You can come back down and then go back. You shouldn't be feeling your pelvis tilting left and right. If it is, then this exercise is probably a little too hard and you should just stick to bridging up and down. It takes a lot of hip muscles on both sides to keep your pelvis stable when you lift the leg up. Also, if this bridging position aggravates your low back, don't come up quite as high off the mat. Sometimes that helps a little bit. Let's do 3 more of these. So exhale, foot comes down, inhale, knee comes up, exhale, and inhale. It's a lot to think about with the breathing, especially when I'm talking to you at the same time when you're trying to think about what I'm saying. But the breathing really helps get those abdominals engaged a little bit further. Last repetition. And relax. Very good. Okay, so we'll stay in this same position, but we're going to move to what I call tabletop marches. So you can modify this exercise. Brett here is in tabletop right now, and he's gonna tap each foot down towards the mat and back up. If this is too hard, I want you to keep both feet on the mat and just lift up one leg, bring it back down, and alternate back. Okay? You shouldn't feel like your back is straining when you're in that tabletop position. All right? So go ahead and get that abdominal brace. Belly button scoops in towards the spine. You're gonna lift up both legs. Hold it, make sure your back is flat, and then tap the table. So as you tap the foot down, you should exhale. When the knee comes up, you're inhaling. So we're exhaling on the most difficult part. And that's gonna help keep your back flat and your abs engaged. Let's do 3 more, Brett. Good, and relax your legs down towards the floor. Very good. So some people, when they do this one, they feel it more in the hip flexors, kind of right at that hip joint in the front. If that's happening to you, then this exercise is probably too hard and you should keep both feet on the mat. You want to feel your abdominals engaged. You don't want to feel those hip flexors compensating or your back arching off the table. Okay, so let's try that one again. Hold the belly button down and in, both legs come up, and then go ahead and tap. Remember, you're exhaling on the tap, inhaling when the knee comes up. You feel your abdominals working, Brett?
A little bit.
A little bit.
Good.
Good, and go ahead and relax. Okay, we're gonna make this a little bit more difficult. If you remember the dead bugs, I'm throwing Brett a new one here. He doesn't know we're doing this one. So we're gonna do the dead bugs just like we did before. So if that is your level, do it just like we did before. Brett's gonna show us how to do it a little bit more advanced. So he's gonna come up into that same tabletop position. And then when one leg goes out straight, the opposite arm goes back towards the head. Okay, so he's gonna alternate arm and leg while keeping that tabletop position. He's exhaling when the arm and leg go out. Exhale. As they come in, he inhales. Very good. Good, so your back should be flat the whole time on the floor. And if this is pretty difficult, it's difficult for me, this is a challenging one, then your leg doesn't have to extend all the way out straight. It can go out just an inch or two, and the arm goes back towards the head. Why don't you show them that, just below small movements of the legs, even smaller. There we go. So further out the legs go, the more challenging it will be on your thumbs. The closer the legs, the easier. Go ahead and take a break here. That was really good. Okay. All right, let's move in. You felt it more so than, yeah, that one's tough. Okay, so let's go ahead and move into a little bit of stretching for the last few minutes. So first of all, let's do some rocking side to side of the knees. So I call this lumbar rocking. This is something that usually feels really good. It gets the rotational muscles in the spine activated. It shouldn't be painful at all. If it is, just don't go quite as far with the knees side to side. So this is something I like for patients to do when they're having that pain, or in the morning if you wake up really stiff. This is a good one to do. So I just wanted to kind of throw it in here. Couple more. All right. Let's go ahead and move into that piriformis stretch that we had done before. So there's a couple different ways to do it, like we talked about before. You'll cross one ankle on the opposite knee. If this is enough for you, you can push the knee out. If you feel a stretch there, just hold it. If you don't feel a stretch there, I want you to bring the leg towards you, just like Brett is doing here. So you'll try and relax your upper back and your head on the table so that you're not straining. You're just bringing that hip forward towards you. So you should feel it behind the hip and the glute. It should be a pretty good stretch for you. This is one that helps a lot with that sciatic pain going down the leg. We'll hold it about 20 more seconds here. All right, go ahead and switch sides. Same thing on the other side. You'll cross one ankle over, just push out if that's where you're at. If that's not good enough, go ahead and pull the leg up towards you and relax the head. Go ahead and switch to the opposite side again. We're going to do this one more time on each leg. I like to do these after exercise, like the clams or the bridges, things that really work the glute muscles. All right, go ahead and switch last side here. Go ahead and relax. All right, that concludes our session for today. Hopefully this was helpful and maybe answered some questions you might have had earlier. So go back and review the other exercises we've done now that we've worked a little bit more on breathing and core contraction, and see if you can do some of those advanced exercises. All right, I'll see you guys next week.